I'm here with the beautiful Tara.
Hello.
So Tara, I'm going to dive straight in.
Okay.
Now, you're a dentist.
I am.
But you don't practice much dentistry, do you?
Not currently, no. So it's kind of fizzled out a little bit.
What is it that you do?
So now I focus heavily on facial aesthetics or aesthetics in general, and expanding slightly into more skincare, body treatments, and I've started an academy to teach facial aesthetics also.
But tell me about this academy.
So I started with two of my amazing colleagues, Dr. Wasim and Dr. Sheila, called the London Academy of Aesthetic Medicine.
Amazing.
LAM for short. So the main reason that we started it was because we felt there was a lack in the market in a certain area of the way that we're taught how to do facial aesthetics.
Okay.
Have you
I've done one or two courses.
Yeah, so I saw that you do like Botox and stuff for patients. So I feel like a lot of the courses are taught quite similarly.
Yeah.
And especially with toxin courses, they kind of break it down into a basic and then an advanced, whereas with toxin, I just feel like, well, we felt as collectively that you could teach it all in one day, and I feel like you get so much more out of it, you get so much more practice with it. The main aim for us was to give people as much experience with patients, live models as possible. And essentially it's just as comprehensive as we could make it, and a collective effort with all of our experience, I think, works really, really well. So we're in the process of kind of expanding it, and we're going to go into the filler course soon. So it's really exciting.
It does sound exciting.
Yeah.
So at the moment it's mainly toxins, and then you're going to go into fillers.
Yes.
And it's aimed at dentists, doctors, nurses, everyone?
Doctors, dentists and nurses, yeah.
Amazing.
Yeah.
So what is it that you love about facial aesthetics? Because you've obviously switched from dental to facial, so what is it?
I love the artistic side of it. Granted, with dentistry, there's still some art to it, but I think I just flourished in the aesthetics world. I love that you can make someone feel so much better about themselves in terms of confidence, or it might be one area of their face, for example, that they're really conscious of.
Yeah.
And I struggled with the idea of it at first because I was in the mindset of, is this the right thing to do to promote like changing yourself?
Yeah.
But really, if someone wants to do it, they're going to do it anyway. And I wanted to be the person that would do it ethically, safely, and look at them as a whole. And also, I enjoyed it. I got really good like feedback from patients. Everyone was really happy, and it kind of just went from there. And I've learnt so much along the way. I continuously want to learn more. I'm always looking up new products, new techniques, new things we can do with it. So yeah, that's why I love it.
What is your views on facial aesthetics and mental health? And you touched a little bit on that.
Yeah, good question. Touchy question as well.
Yeah.
So I think as medical professionals, we're a little bit more aware of the things that we need to look at in terms of psychological health and well-being.
Absolutely.
Looking at the patient as a whole. And really understanding why they want it, what their expectations are, whether we can meet them, and whether we're crossing a boundary and actually it's becoming unhealthy for that person. So I believe it can help a lot of people. I've experienced it firsthand, where just something simple as, I feel like I always have to look at someone in the face because I'm scared of my side profile. So for example, with interviews and things like that, or I've got a lot of patients who kind of want to go into the film industry.
Yeah.
So the smallest thing can give them the biggest jump in confidence.
Absolutely.
So I wouldn't want to go too far with a lot of patients, and I do say no a lot of the time.
So you do say no?
Yeah, 100% will say no if I don't agree with it. And I think that's where I gain a lot of respect also with my patients, I'd like to think.
Do you remember a case where you had to say no to someone?
Yeah, I literally, like every day I at least say no to one thing. They might come in wanting a few things and I'll be like, you don't need this, you don't need that, or let's think about something else, or something like that.
You're treating them as a whole and you're seeing what's...
Yeah, exactly, yeah.
So do you feel like, how do people say that as dentists and healthcare professionals, we put up all these befores and afters, and we almost might be putting that insecurity in people's heads that they should look a certain way. Do you think that's true with what we're doing, or do you think we're providing them actually a platform to see what they could have? I don't know.
I think it's a mixture of both.
Yeah.
I think it is a mixture of both. But the important thing is when you are putting up these before and afters, it's about educating.
Yeah.
I don't like to make drastic changes either. So my motto is enhancing the natural beauty you already possess. So I don't like to change anything drastically.
Oh yeah, because you call it enhanced by Tara.
Exactly.
Enhancing what you already have, you're not changing. I
Yes.
like that.
And I also, when people come to me, I do like to, if I feel like there's an element of self-doubt within themselves, I do like to kind of counsel and give them just a little boost in terms of like more psychological, like everyone's beautiful as they are and you don't need to do these things. So yes, before and afters can have an effect in the sense that the more people see it, the more they may want it when they didn't.
Yeah.
But that's like everything. That's
But you're also
advertising. It's a
empowering people
business.
to find you to be able to correct any insecurity they do have.
Yes. Yeah.
What would you say to those that do feel insecure about the way they look? You know, men or women who maybe don't want to have facial aesthetics, but they're insecure. What kind of, like you said?
So I've worked a lot on this for myself in the
Have
last
you?
year. Yeah, it's been a journey,
Oh.
but a good journey.
Yeah.
Difficult at times. The main thing really is, number one, is to surround yourself with people that inspire you and make you feel good, rather than people that are around you that may always have a slight negative tone. It might not even be massively negative, just the slightest thing that, you know, for example, women always talk about their weight. If you surround yourself with friends that are always like, oh, I wish I could lose this extra few pounds, or I'm watching my calories here and there, it's an understandable concern, but if they're constantly talking about it, it then puts it into your head. So just being aware of who you surround yourself with. I listen to a lot of kind of podcasts now on like self-help, self-motivation. Jay Shetty is one as well. Like overall, he talks about like relationship advice and everything like that. I do like affirmations for myself. So I've got like, the beads, and there's a theory where you say it 108 times. So every day I try to do it 108 times. And it could be like a simple thing of, if I'm feeling a little bit down, like in terms of health, I'll be like, I'm feeling better, I'm feeling well, I'm feeling better, I'm feeling well, and I just say it 108 times.
Vibes,
Yeah,
like
so all of those kind of things, and even if you change something about your face or your body, that's only going to give you a temporary happiness.
Yeah.
So it's really just working on yourself.
Yeah, that's amazing. Sorry, I feel really touched by that. I'm just going to take that in because it's true, because you're absolutely beautiful. So for you to actually be feeling like that as well, it must be so many people out there that think that getting this done or getting this done will make me feel better, but it's about actually accepting you.
Yeah,
and then it's fine to have these extra things. No, that's absolutely amazing.
And also giving back to people
Yeah.
makes you feel so much better as a person. Well, that comes from experience. I don't know if everyone would feel that, but just giving to people, so being kind, being generous, and the love you receive back automatically makes you feel better as a person. Then the physical side of things just completely go. So I'm a big believer in like kindness and giving.
Oh, amazing.
Yeah.
So with all of this, obviously this is part of your mental wellness routine, we'd call it.
Yeah.
Do you have other things that you have in there? Do you exercise? Do you have other things?
Yeah, so I used to be really overweight.
Okay.
Massively, maybe not massively, but I was very overweight at one point. And then I managed to kind of get it together, lose weight. And then I went through a phase of the aesthetics kind of picking up, and I kind of lost track of myself. And that was the time where I wasn't focused on me at all, and it was just business. And then in May, what year are we now? 2019. So May 2018, I started getting really into fitness. I started with my personal trainer, and now I love it. I really love it. It's a way for me to have me time.
Yeah.
I schedule it in my diary so I know it's there.
Yeah.
I go to the gym about 4 times a week. When I'm on holiday, I go to, like, it's just my release. I love it. I'm not like amazing, but it's a really good way, number one, to stay active.
Yes.
Especially with dentistry, for example, where we're just sitting all the time, pretty much. It's a way to get my mind off it and clear my mind, and it's a way to push myself as well. So it's good to challenge yourself in different ways.
Do you still do a bit of dentistry then?
So I stopped about 2-3 months ago, but I'm starting again in 2020, so January, February, once the academy is a bit more settled.
So why did you, obviously you do more facial aesthetics now, but you study dentistry, so why did you study dentistry?
So it was never something I thought I was going to do.
No.
I didn't know what I wanted to do at the time. Everyone was doing work experience and you'd have to choose your A-levels. Yeah. A family friend of ours suggested that I go and shadow him, and I did. And I really liked it. he was really good with patients. I saw the social side of it, I saw the artistic side of it, I saw the science side of it, and I loved the combination of all three. And then that was it. And also in terms of once you finished uni, from a functional and practical point of view, that's it. You kind of set. You don't have to worry about what you're going to do and things like that.
So are there parts of dentistry that you miss now that you're not doing it?
Yeah. So like in my old practice, or the practice I was in last, I get messages from the other dentists just saying like, this patient asked about you. And so I really miss like the people and the patients. I miss being able to change a lot of patients' conception of dentists in terms of like, we're only after their money, or like we only cause pain.
That's what I'm hoping Denfluence will do.
Yeah, I think we're really not out there for that, by the way. We just want to help.
Yeah, we do.
So I miss that. And obviously the practical side was always really good too. Like, I do miss it.
Yeah. What's the bit you don't miss?
The paperwork, the difficult patients. Although I enjoy that at the same time. I like a challenge. I like to turn them around. So I don't actually dislike it.
You like that they leave a lover? They come in hater and they leave a lover. It's like,
Yeah, I make them my best friend. Like, you're going to be my best friend, don't worry. Yeah, there's not much that I don't like. Yeah, no. Do you know what, actually? I don't like that there are so many options for treatment that you're stuck. You're like, wait, what can I do? I can do this, I can do that, I can do that.
And then you have to give them to the patient, and the patients look at you like, what should I pick?
Yeah, and it's just a bit of confusion, but that's fine. It's just my perfectionism coming through there.
So with dentistry and facial aesthetics, which one would you say is more stressful if you were to put them in
that kind of category?
They're probably quite level,
Yeah.
I would say. So if you think about dentistry, the stress comes from dealing with patients who maybe have really high expectations, nervous, things don't always go to plan. You know, treatment plans might change, and then again, the misconception of dentistry, the paperwork, the chance of the legal side of things, you know, all of that. But then on the facial aesthetics side, the stress is more dealing with, again, people's expectations, but people are coming to look better, and everyone's idea of looking better is different. So it's dealing with the conversation at the beginning, and sometimes it's quite sad for them to not get treatment that they may have thought could help them, but otherwise it's not that bad. Things are stressful if you make them stressful, really, aren't they? So it's just having a calmer head about it all the time.
Well, have you ever had a complaint?
Yeah, I've had one or two.
And how did you handle that?
Two, maybe.
Because I think that's the thing that stresses lots of young dentists now. They're worried about complaints, what am I going to do, and GDC.
Oh, so I've not had a dental complaint.
You haven't? Okay,
No,
so
touch.
facial aesthetics.
Touch all the way.
What about facial aesthetics?
Facial aesthetics, there was just one time where someone wanted a certain amount of filler in their lips.
Okay.
We took before and afters, and she thought it looked really ducky.
Okay.
That was her choice, and that was it, really. So it didn't, by the way, just saying. The before and after was very, very minimal, but it comes with the game.
Like managing patients and their expectations, right?
Yeah.
So what kind of advice would you give to all these young dentists that are going on courses and now going to dabble in facial aesthetics? Kind of, what would your advice be to them, just holistically?
Definitely don't do it just for money. Although financially it can be very rewarding, it's not about the money. You have to enjoy it, you have to want it, you have to be willing to deal with some people that can be very particular about what they want. Don't be afraid to say no. If it's out of your comfort zone, don't do it. And be prepared for anything that can go wrong as such, so any like complications that could happen. So just be really up to date with everything, and have someone that you feel you can go to in case of a situation. And practicing. It literally is just practice makes perfect, really. Everyone is different. Every tissue density is different. Every lip shape is different. Every muscle activity is different on everyone. So definitely looking at everything as a whole, rather than looking at, okay, this person wants their lips done, I'm just going to fill their lips. You need to look at proportions. You need to look at the way the muscle sits around the mouth. You need to look at what they want, what's achievable, the type of filler to use. There's so much to it.
So how did you learn all of that? You must have gone to a lot of courses and a lot of training yourself.
So yeah, at the beginning I did loads of courses, and then I think it was just reflection. So again, something you learn being a dentist, you know, self-reflection and working on looking back at things you've done and how you can improve. Every day after a day of treatments, I'll look through my before and afters.
Okay.
And I'll look at like, why does this maybe not look as good as it could be, and then try and figure it out from there.
That's really good. Actually, that's a good tip for all aspects of dentistry, actually.
Yeah.
To be like constantly reflecting and growing. What tips would you give to dental students that are still studying dentistry? So 3 top tips for young dentists.
Don't give up, it gets better.
Yes, that's true.
Learn to love it even if you feel you don't. You have, again, it's similar to the affirmation thing. Just keep going and literally repeat to yourself, I'm enjoying this is what I want to do, etc. Because there are times that you just feel like really bombarded with everything, like really down. I've gone through that like twice with dentistry, once as a student and once after I qualified. And third is never stop learning.
That's a good one. CPD, we have to anyway.
But yeah, never stop learning.
Yeah. So somebody's just completed a facial aesthetics course.
Yeah.
And they're about to see their first patient. What advice do you have for them treating this person?
So what works really well for me at the beginning is having almost like building blocks of a routine.
Yeah.
So when you do courses, or if you were to go to a course, what I would really suggest is pay attention to what you're doing and write everything down in terms of sequence of events. Okay. And even just little things like making sure you're really prepared with all of the material you need, because that can be really like faffy. So if you've got a list of everything that you may need, even if it's the slightest chance, just have it there. A sequence of events. So for example, talking to the first thing, simple, like everything, like talking to the patient, talking about their needs, and write a list of everything that you would ask a patient, similar to a medical history questionnaire. Then it would be like consent, then it would be explaining the procedure, risks, etc., numbing cream, and then look at videos, like literally videos on YouTube, blah, blah, blah. It will just bring it back. And have someone that you feel you can call in an emergency, for example, so you feel at ease if anything was to happen. Another option is to have someone there with you. So some people mentor, for example, or do it in a clinic where there are other people around that can help.
Will your academy offer that?
We offer mentorship afterwards, but we're not around at any point. Hopefully that will change. We have some ideas and some plans for the future.
It's growing.
Yeah, it is.
You're seeing
clients, you're building an academy, and then you're also growing your Instagram. How do you have time for social media? You've got like 20,000 followers. How are you doing that?
It takes a lot of work, loads of work and time.
Yeah.
But I enjoy it so much. I also have an assistant who helps me reply to messages and things like that. But I'm in charge of all of the content that goes on, essentially, because I like to be in control of what people are seeing, because it's me. Yeah. I'm my brand, essentially. I just make the time. Like literally between a few patients, I'll do like 15 minutes if I've got 15 minutes. And just little blocks here and there just work. With Instagram, it is very consistent. You have to be consistent throughout the day. You can't just really do an hour in the evening. It doesn't really work like that. So if anyone wants to build their Instagram, consistency is key. And like putting before and afters up, I will dedicate, for example, an hour and a half, 2 hours a week, just putting my before and afters together. And then throughout the week, it's quite easy to just then post.
It's like a full-time job, isn't it?
It is, yeah. Yeah.
So how did you grow
your following though? So how did you get to 20,000? Was this like over a couple of years? Like how did you do this?
I don't actually know. I think, yeah, it's been like 3 years since I've had Instagram. I think, again, just consistency with my posts. I think I go for quite a personal approach with my Instagram. There are some practitioners or clinics that decide to be very much just before and afters and
clinical,
without much of a personal touch. I prefer the personal touch, and I think that helps from my experience and from feedback I get. And I interact with a lot of people as well. So like if people reply or ask me questions, I make sure I try and reply to every single person.
Yeah, you're quite good like that.
So again, that is probably why. I don't know. I haven't really looked into. I haven't thought about it. It's just happened organically.
Okay.
Growth.
Yeah, I haven't really thought about it yet.
Organic. I didn't buy my followers. Well, what do you say about those people who do buy their followers? Because obviously social media has become such a big thing now. Everybody wants to have 40k followers.
Yeah, I think. Do you know what? It's not a bad thing if you've got a reason behind it. So sometimes it is just to get people's awareness because they think, oh, this person has 40k, and then they go onto their page and look through a little bit more. So I can understand it, and I understand the concept behind it.
Yeah.
But it's just up to the consumer or the person looking at it to figure out what's real and what's not. But it's an understandable market strategy. It's all market, it's business, it's just the way it is. There's nothing wrong with it. I'm not a fan of, everyone's got these things to say about everything, and I just feel like, why? Just get on with your own stuff. Like, you don't need to talk about someone else and the way they do things. If you don't like it, don't look at it. That's it.
Yeah. That should be like your catchphrase. Don't like it, don't look at it.
Yeah. I get so many people like commenting on, but this person didn't need it. And I'm like, yeah, they didn't need it. And I will happily tell the patient to their face, you don't need it. Because a lot of people come to me and say, what do I need? And I'll be like, you don't need anything.
Yeah.
But if you want to do something about what you've complained about, we can do this.
Yeah. There's a
So-
difference between want and need, isn't
Yeah,
it?
exactly. But people just have this urge to comment and like almost.
Why don't they just like skip past your page?
Yeah.
Why hate? Go see someone else.
Yeah.
But do you get a lot of hate comments? Like, is that quite frequent?
Not as much as I thought I would have when I first started, but I've had a few, yeah. But I don't like,
Does that
again,
make you feel sad? Like, does that bring you down?
I get more defensive for my patients because I'm like,
Yeah.
imagine they saw this and then they feel bad that they've had treatment. That's when it kicks in. But I don't feel sad. I feel sad for them that they have to comment, to be honest.
Yeah.
Maybe they're just miserable themselves.
Yeah, or maybe they want it, but deep down don't want to admit it.
Yeah. Well, because the taboo around facial aesthetics has really died down, because I don't remember it being so widely accepted before. So what do you think it's social media that's made facial aesthetics more acceptable now?
Possibly, and I think people who are in the public eye as such, I think a lot of them are becoming more open and honest about treatment that they receive. And also the way treatment is carried out is very different. It is going down the more kind of preventative route, just restoring lost volume and more natural approach rather than I'm going to freeze your face or make your lips huge.
Like Spock and Duck.
Yeah.
That's not there anymore.
No, it's going.
First word that
You look really nervous.
I know, I'm so nervous.
first word that comes to mind when I say passion.
Love.
That was my next one. First word that comes to mind when I say love.
Family.
Oh. Teeth.
White.
Nah. Purpose.
Ooh.
Ooh.
Oh.
We'll take you. I accept that.
Okay.
Friends.
Love.
Oh, there's so much love in there. I'm just like feeling it. Okay.
Alternative career option.
Architect.
Well, because you're like building faces, building teeth. I see it.
don't know, I just love... It was just something that I wanted to do at one point.
Really?
Fun fact, I failed first year of dentistry and then I was thinking of doing architecture.
That's amazing.
Yeah.
You failed first year of dentistry.
Yeah.
There's a lot of people there that probably out there that do fail and then think that's it, I'm done, and they get kicked out or they just leave.
Like, what advice would you give to those that do fail?
So that's when I think I started to grow up mentally, because I failed because I was just being a little bit of a throwing my toys out the pram. I'd been at the same school for such a long time, knew everyone at school, moved to this big establishment, didn't know anyone, didn't move out, so lived at home. Coming from a Middle Eastern family, like my dad's a little bit more kind of reserved, so didn't go out all the time the way that other people did. And because I lived at home, it took a while to travel back and forth, and I didn't want to stay out, I just wanted to go home. So I didn't make many friends, just didn't enjoy it. Failed. Probably one of the I wasn't used to failing, like I was so good at school and loved learning. Wasn't used to failing. Probably one of the lowest times that I've had in terms of career and education. And then was given the chance to repeat the year after I appealed, and decided that nothing's going to change. I just have to change my mentality if I really want to get through this. So similar to what I was saying earlier, I decided to do this, I want to do this, I will enjoy it. I decided to do this, I want to do this, I will enjoy it. Yeah. And then just made more of an effort to be social with people. And I also got a dog at the time.
Nice.
So that helped like just make everything feel better.
So a dog, positive affirmations.
Get a dog.
Make friends.
Life lessons.
Yeah.
Sorry?
Have a picture of your dog.
I do. So glad you
So-
asked.
Yeah.
There we go, that's one. He's really cute. He doesn't look very cute though because his hair's overgrown.
So you were saying that university was like a stressful time for you. You
Yeah.
just about passed. Is that?
Pretty much, yeah. So when I first started, I was like, I'm going to pass with honours. I'm going to pass like the best I can pass because again, I was really good at school. I worked really hard, like A's, A stars.
Yeah.
And then obviously dentistry was different,
Yeah.
and I didn't get what I wanted to. And I think after the first and second year, it was a bit kind of demoralizing. And then I just accepted it. I was like, as long as I pass, it's fine. Like I'm still going to be a dentist at the end of the day.
Absolutely.
And it's what you do afterwards that matters the most.
Yeah.
Because I'm not very good at learning facts about a cell or about
An amoeba.
the way the kidney functions and like potassium. Like I like it, I enjoy it at the time I'm learning about it, but I'm not good at like retaining the information. But the practical side I was really good at. So that was the most important thing. The practical side and obviously the knowledge that goes with the practical side so you're safe and know what you're doing. So I just accepted it and just passed just about, but that was good enough for me. Like I got there and I'm very happy with where I am now.
What would you say to those uni students that are struggling and that are stressed about passing with honours and, you know, they kill themselves, literally?
Yeah, I think getting into dentistry is difficult as it is, and we're so used to being kind of top of our class because you had to be to kind of get into dentistry, but it's okay. You're in a situation and an environment where everyone is on the same level, if not higher, maybe a few lower than you, compared to school. So it's not the same environment. You will get to where you want to as long as you work hard, but don't kill yourselves. There's absolutely no point. Like you said, you're in the same situation with your brother and you passed differently. It's life. Just make what you can of the situation.
Beautiful pearls of wisdom.
Okay, on a desert island, 3 things that you would take with you.
I always ask this to people, but never think of the answer myself.
You too.
3 things.
Yeah. You're lucky you didn't say 1. You've got 3.
Are there? Okay, I'm just
Okay.
gonna. Okay. Can I take a laptop?
Yeah, go for it. I didn't say there's Wi-Fi there. So you got a laptop.
Okay, can
now,
I
you-
take that back?
No, you can't take that back. It's already there. I made it for you on the island. Now you've got 2 more.
A Wi-Fi thing,
She's smart.
and
I'll be nice, I'll give you food and water, you don't have to take that with you.
okay, great, thanks. Because I was thinking about a fridge, and then I was like, then I have no electricity. To keep the fish that I catch cold and fresh.
She's really catching it. I was wondering what that pause for. She was like in like...
Tony was
Tarzan mode.
imagining everything. What else? Sun cream.
This is how we know she's in facial aesthetics. SPF.
Yes. Very
Is
important.
it important to have 50? I wear 30.
That is fine.
Okay, cool.
50 on a hot day.
All right. Weirdest treatment request. I know somebody asked me the other day if I could Botox their bum.
No, I was like,
Really?
that's not how Botox works.
Yeah, not quite. I don't think I've had any weird ones.
So lucky.
Some people want like, it's not weird, but it's just not that possible to do like nostril work, like to bring that. A lot of people feel like a lot of their nostril shows, they want their nostrils to come down, but that's more surgery.
So there's no way of doing that?
Not really.
Okay, stop asking her. All right, where would you go if you were invisible?
Oh.
She just
I
thought 50
really-
places. I know.
Yeah,
I can
honestly,
see it.
Invisible. I'd really like to go into the White House. I'm not a big fan of politics, but I would just really like to see what's going on.
Watch out, Trump. She's coming.
Yeah.
Where's the White House?
I don't know. I feel like there's a lot of secrets and I want to know the secrets.
Wouldn't you want to go into the... No, that hidden place. Area 51.
Oh, yeah.
Oh wait, maybe there's a Pentagon as well. I want to go to Pentagon. Do you want to go there?
Let's do all of them.
That's where the aliens are. They keep the aliens there and they do the brain
Do
surgery.
you believe in aliens? I do too.
Am I supposed to believe in it? I believe in aliens.
I believe in aliens.
Yeah, there's some
Have you
sort
watched
of-
Ancient Aliens?
No, I haven't.
Watch
I'll
it.
put that on my
History
watch
Channel.
list.
Or Discovery Channel.
History Channel.
One of the two. Anyway,
thought
you
it
can
was
YouTube
Discovery.
it. So good.
I'm going to YouTube it.
You'll be
Okay.
a bigger believer.
Really?
Mm-hmm.
Okay. What's your spirit animal?
Penguin.
I don't see it.
Really.
Yeah,
I'm
'cause-
really clumsy.
Are penguins clumsy?
I have short legs.
Okay.
Yeah.
We'll
And I
walk-
waddle.
You what? We will give you that.
Okay, one person you think is underrated in the aesthetics industry?
Oh, good question. Of the people I know,
Yes.
can I give two?
You can give two.
So there's Dr. Sheila, who is the people I work with in the academy, so Dr. Sheila and Dr. Wasim. They're both amazing. Dr. Sheila has the most knowledge anyone could ever have. And she's so kind of particular, and I love that about her. And Wasim has had so much experience. He's had amazing patients come through his door, and he's just such a lovely person. And again, will never do anything that he feels isn't right. If anything, he kind of deters people from treatment. He's that great. Yeah, both of them.
You all three have kind of the same ethos, don't you?
I love it, and that's why we work so well. Yeah.
That's good.
It's hard to find people like that.
Exactly.
Okay, so what is your biggest fear?
Spiders.
I should say that because I feel the same. They've got too many legs.
And they just creep up on you.
Yes. Do you know
And you don't know if they're in the room or not.
Yes. And these days they're fatter than usual, aren't they?
The other day, I was walking with my sister, and there was one on the pavement when we were walking back from dinner. Honestly, like, I'm not exaggerating. This big. And yesterday, I was doing some like stretches on my floor, and a spider literally ran across, and I screamed so loud.
Did you catch it?
No.
Shit, it's still in your house.
Yeah.
It's going to get you. Like, I
I
can't
know.
leave until that thing is dead. I mean, safely evacuated in a glass bowl, and my husband doesn't kill them and puts them outside. Okay. A dental colleague that you admire.
Rona. I think Rona's amazing. I think she's really pushed the boundaries in terms of her own kind of knowledge and expertise. I think she's really current, if that makes sense.
Yes, she is.
She's really preventative with it's preventative dentistry, and it's not kind of really destructive dentistry either, because of the whole, she's really focused on Invisalign, whitening and bonding.
Yes.
And as like from what I've seen, she was someone who started it very early on.
She did.
And kind of set the trend as such. And as a female working so hard, not that it takes away from men working hard, but as a female it is a little bit harder in this industry, I think.
It is.
She's done really well. And she gets a lot of kind of slack as well sometimes from people that just, I don't know why they don't want to see her succeed. I don't get it. I just don't understand. But anyway, she's my fave.
Okay, so who would you nominate next for Denfluence? Nominations, so other Instagram dentists that you think I should catch. You can give me a couple, I don't mind.
I think, obviously Sheila and Wasim, we already know, I love them. Shavana. Yeah, she is amazing as well. She does so much that you wouldn't know. Like, she set up dental training consultants where she trains, or not trains, it's like mock interviews for foundation.
Yes. Yeah,
I think that's a really good avenue to go down as well, especially if you've got students watching. She's really like something special.
Thank you so much, Tara. It's been amazing.
Thanks for having me. Yeah, same.